Hi everyone, and I think during COVID, one thing COVID has definitely taught us is your health is extremely important. Even if you contract COVID, doesn't matter. But then, if your health is fine, I'm sure you will be able to manage through whatever other issues you're having in your health. Isn't it? So, I just thought that we will go live with Dr. Vinti, who is a dentist turned, not really turned, I would say. She's a dentist come fitness coach. So, having done her graduation from YMT Dental College, she went ahead and did her post graduation. Okay, 1 minute. Let me just get Vinti on board. Yes. So, yeah, 1 minute. Just give me 1 minute. Yeah. So, having done her graduation from YMT Dental College, Vinti went ahead and did her. Hi, Vinti. I'm just introducing you. Hello. So, she went ahead and did her postgraduate diploma in restorative dentistry from the University of Michigan. And then she fell in love with whom? Well, that was health, wellness, and fitness. Much better decision, okay? Rather than falling in love. So, hi, Vinti.
Thank you, ma'am. Thank you so much for having. So, our vision was pretty clear last year, actually, when the pandemic obviously hit us. We started this venture, and our vision was to get people to move because they were obviously at home. They had a little more time on their hands, and they could use that productively. Obviously, a little bit towards health, towards wellness, towards their body. So we started this out basically to get people to feel better, to feel fitter, to feel stronger. And I think the vision is still continuing. We're trying to build on it. We have just completed 1 year. This August, we completed a year to this program. And it's mainly what we do is functional training. And I know like functional training, functional fitness, CrossFit, now these are very hype words. Everyone uses them. But in simple term, these are movements that are a part of our everyday life. We at some point or the other are doing these movements. These are movements that feel very natural to our body. And that's how we got it started, and absolutely enjoying the journey.
Well, let me tell you guys that she is also, I mean, along with being a fitness coach, she was also an athlete. So probably that helped you better to start off this fitness coaching, right?
Absolutely. So when I started out, honestly, I started out when I was just completing my internship in dental school. And obviously, I had been inactive for all 5 years. I was, absolutely unhealthy. I think that was like the most unhealthiest time that I had those 5 years, because there was absolutely no time, right? There was no time for fitness or for healthy eating habits. So that's how I got started. I started out as an absolute beginner. And from there, because I found something that I genuinely enjoyed, it was easy to stick to it. And then obviously the more you do it, the more you're consistent with it, you get better at it. So that's how I started out. And I was like, this is something that I definitely want others to enjoy also. And I want others to be able to learn and also see what their body is capable of doing. So that is how I actually got started, got certified, and started coaching.
Wonderful. So tell me, how does one get started with the fitness journey? Like, everyone knows that, okay, you go to the gym or you start running out. But what is the motivation? What should one do to get started?
Okay, so I think getting started is the harder part for everyone, right? We always think that coming Monday we'll start, or maybe we will start the next month, or maybe, you have a wedding coming up, so you have to lose so and so kgs by this state. That's usually that's like the motivation to get you started. You have a certain goal in mind, you think your motivation will push you through. Probably it will push you maybe for the first 1 to 2 weeks. After that, you have to push yourself. Your motivation is not going to push you obviously anymore. So I would say if you're just getting started, start out very, very small. Right? Maybe do some things that are very easy to do, something like maybe just walking, running, maybe get a jump rope, do skipping at home, incorporate like very easy movements, something like say squats, lunges, push-ups. These are natural movements. You don't need any equipment for it. You can do it in any corner of the room. And maybe just start out by giving 20 to 30 minutes to your body, right? 20 to 30 minutes where you're not thinking about work or you're not thinking about anything else. You're just focusing on what you're doing for those 20 to 30 minutes, and maybe incorporate that 3 times a week, or to start out even maybe twice a week is enough. Once you start enjoying it, once you start seeing, so more than that, I think what keeps people going is once they start seeing results, and once they start seeing that yes, our body is improving, we're getting better, that keeps them going. Then you want to, now from thrice a week, you want to work out 4 times a week, 5 times a week. So that it's a slow process. It will take maybe 3, 4, 5 months, but it will definitely work.
Yeah, so when you talk about when people get encouraged with losing weight or something, so some people like me never happen to lose weight no matter what I do. Because the motivation level really goes down. What do you do during that time?
So like I said, like motivation will probably just get you started, right? Motivation is nothing but it's a feeling. I have work, I'm not going to be motivated every single day to work, but I know it's my responsibility, so I have to get out of bed and I have to get to work, right? It's the same thing. It works the same way with even with fitness or with any aspect in life for that matter, right? You have to, after a point, be disciplined. So discipline is always going to take over motivation. Motivation is going to come. Some days you're going to be highly motivated. Some days you're just going to be like, I don't want to do this. So on those days, you need to be disciplined enough to say no, that I have to. It's just 30 minutes. I need to give 30 minutes for my own body. You're not going to do this for someone else. No one else is going to benefit from it. It's you that's going to benefit. So just realizing that and pushing yourself is what is going to get you. Then don't complicate the process, right? If you just have a goal in mind, stick to that, do the basics and do it well, and you will get the results.
Right. So when we talk about fitness, how what kind of movements and patterns can we incorporate, or workout can we incorporate in our daily life, which is not going to be very difficult for especially people with lot of back pain or knee pain or stuff like that?
Sure. So again, like every individual is different. For every individual, the workout plan will also be slightly different. Obviously, if you are a beginner, just to start out with, maybe walking and running would be the best. What that will just do is it will get your cardiovascular system going. It will help you build like the baseline, just that little bit of stamina and endurance that your body needs. Now, once you have that baseline stamina, from there, then you can advance a little bit. Like I said, like at home, maybe you can just do simple movements. Do something like squats, hold planks at home. That will help you basically develop just a little bit of core strength. Once that improves, then you can start using a little bit of resistance. You can add resistance bands. You can use free weights. You can use dumbbells that are, just even one pair of dumbbells if you have at home, that's more than enough. So you just have to progress slowly, 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 depending on where exactly you are at your current fitness levels. Obviously, if you are someone who was fit before, maybe even just playing something as simple as a sport. If you're playing maybe say cricket, football, badminton, even this is good enough. It is going to really, really, really boost your fitness.
So, as we talk about other things, we also talk about nutrition. Yeah. We all are dentists, we all are doctors. We do know what nutrition is, but how many people really follow it? I wonder. Because that craving for cake or sweet or something develops, then it's extremely difficult to get over it.
Absolutely, absolutely. I totally agree. So I am not going to say that I am not guilty of doing the same thing, right? Even when I started out, it was the same. And even with nutrition, like I would say as a science, it is very complicated. It has a lot under it. And especially I feel even with just social media booming so much, there is so much of information out there and people want to follow a little bit from everyone. Like maybe they see their friend following a certain diet. They also feel like, maybe we should follow this and it'll work for us. But then again, you have to understand that you as an individual are very different from your friend, right? Or from your neighbor or from your colleague, and what might work for them is not necessarily going to work for you. So just to make it, very basic, stick to balanced diets at home. Just have a hard look at your plate and see if that is balanced firstly, right? If you see that you're eating vegetables in a good amount, you're eating one good source of protein, and then you're adding rice or maybe roti to that, that is a good balanced meal. But what happens in usually in Indian households is you'll see a lot of rice, you'll see maybe dal, and you'll see vegetables. Now that kind of throws the balance off. You feel that's balanced, but it's not, because again it becomes very carbohydrate heavy, right? So you want to try and balance out your macronutrients, and I would say try and stick as much as possible to home food. Not because I'm saying home food is healthy, but what you're putting into your food at home. You know what oil you're cooking with, you know what ingredients you're using at home. So try and stick to home cooked meals more, and try and keep it basic. Don't fall for fad diets, or don't think that you can just skip meals and that will help you lose weight, because in the long run you won't be able to do it for maybe more than 1 to 2 months. You'll go back to your normal eating habits and then again put the weight back on.
Right. So considering that most of us are dentists over here, what kind of posture, especially like we suffer so much because the cervical spondylosis or back pain, upper back pain or lower back pain,
Absolutely.
what posture do you recommend? Like if you could just show the posture or explain about it.
Yes. So obviously posture is going to be super important, not just for us as dentists, but even for people who are working at home, even for people who are working in an office setting. That posture is important for dentists more so, because they are going to be prone towards, mucoskeletal conditions are more prone in us as dentists, because of our, prolonged, we are sitting in that position for long periods of time, probably every single day of our lives. Right? So very simply, what the first thing that we can do is just being more mindful about it. So till the time you do not actually consciously try and correct your posture, it's not going to happen, right? You are usually, like, you have multiple patients, you're going from one patient to the other, and you might not realize what your posture is while working. So you'll just have to be a little conscious about it and develop the mind muscle connection to tell your body that no, this is the posture that I need to maintain, right? And what you can do very simply is firstly make sure that you keep your shoulders behind, right? This is the most common thing which you will see with a lot of dentists, is that they tend to sit with rounded shoulders. So it's the whole shoulder is falling ahead and then you're slouching. And for that, what you can just try and do is keep the patient firstly in the correct position. So once a patient is in the correct position, you can keep yourself in the correct position. You're not bending too far down. And then once you've corrected the posture of your shoulders, take care of your lower back. So you don't want your lower back to bend. You want it to stay in that normal position that it's supposed to have, a neutral back, where it's supposed to be a nice S-shaped curve that should be there for your lower back. That is what you want to try and maintain. And obviously with work, sometimes we might not realize and our posture might differ. So for that, what you can try and do is what I wanted to just take a few minutes and show a few stretches that dentists can do even in their clinic. They don't even need to do it anywhere else. You can do it on the chair that you have in your clinic. And this is also applicable, say, to anyone who's working from home or they're working in an office setting. You just need your chair and that's it. You can just do these stretches, remove maybe 5 to 10 minutes from your schedule and do these, and it's going to give you a good amount of relief by doing that. So I'll just
helpful. That would be really helpful.
Yes. So I'm going to actually take a chair so that I can show it to everyone how to do it.
Sure. And there is someone who wants to do a kusti with you, wrestling with you.
Okay.
Much touch food. She's saying that she wants to do kusti with you.
Okay, I do not know who that is.
Well, and yeah, Preeti, in fact, you can send us a request if you want, if you have some questions on that, take you on board. Till then, Vinti can show us
Yes.
the exercise.
So we'll get started with mainly first stretching out the wrist and the thumbs. So we're constantly working with some of the equipments in our hand. So that is the first thing that you want to try and stretch. And these are very simple stretches, nothing complicated here. The only thing that you need to remember is to breathe during your stretches. And if a stretch feels uncomfortable, what we tend to do is just hold on to our breath. And that's what we don't want to do. You want to keep breathing
Right.
through stretches. Right, so the first thing that we're going to do is just stretch out our wrist flexor. So you're going to keep all fingers pointing down slowly. Just try and pull your fingers in towards you. Okay, so that's going to give you a good stretch on the wrist, and then you can maybe hold that for 10 seconds on the right side and then change and hold that for 10 seconds on the left side. Right, from there, then we will try and stretch out the thumb. Again, because a lot of pressure just develops around this joint because we're constantly working. What you want to try and do is just keep your knuckles pointing forward, slowly just pull your thumb in towards you. Okay? What you want to try and remember here is that when you're doing this, try and keep your shoulders relaxed. You don't want to tense up from your shoulders and then do it, because then again you're getting stiff in this area. So try and keep your shoulders super relaxed. Slowly just pull your thumb in, hold that for 10 seconds, and then we'll slowly just change and do it on the other hand. Right? That's just going to stretch out your wrist and your thumb. Once we're done with that, we'll come more to the cervical area, where you'll see a lot of stress build up and a lot of pain and stiffness developing in that area particularly. So for that, the first thing that you want to do is just interlock your hands. You're going to place it behind your head slowly. From there, get your elbows close to each other. From here, you want to slowly try and push your neck up, let your elbows go up, and look up towards the ceiling. So this is also something that we do, just to screen where your mobility is at. You will see with a lot of dentists that they're not able to push their elbows all the way up. It stops maybe somewhere here because this area has become really stiff. So the more you do this, and if you keep including this in your daily stretches, you will see eventually your mobility will increase and you'll be able to push your elbows all the way up. So that's the next thing. That's for your neck. From there, we're going to continue in the same position. Now we're going to apply some downward pressure on the spine. So you're going to slowly try and touch your chin to your chest. Again, just hold this position for 20 seconds and keep breathing. So make sure you're having deep inhales and deep exhales while pushing your neck down. So you're going to feel a stretch going all the way from your neck down to your mid back. Okay, once you're done with that, this is a very simple thing that we're going to do, which is just to relax out the shoulders, rotate them. Right? You'll feel that during the day you're usually slouched and your shoulders are ahead. This is just going to push your shoulders back into the position where they should be. This is how your shoulders should look and how healthy shoulders are. Absolutely horizontal, and there's no anterior inclination over there. So just slowly retract your shoulder blades and roll out your shoulders at the back. Once we get done with that, now we're going to do a little bit of a spinal twist. So what we will do is we will take our left leg, we'll get it over the right. From there, I'm going to use my opposite hand. So I'm going to use my right hand to slowly pull my left leg and look away. So I'm looking on the same side as my leg, but I'm pulling it on the opposite side. So you're going to get a good stretch on the lateral aspect as well as your mid back. Again, a lot of tension and stress buildup we see in that area, so that will help you relieve some of that stress buildup. And then finally, the last stretch that you can do is just get down, maybe keep the chair out in front of you, right? So move slightly behind, and from there keep your arms long and just try and drop your chest towards the ground. So you're going to take a few deep breaths there. Again, that is a great stretch just to open out your entire shoulder, your upper back, your mid back, and incorporating just these few simple movements will keep you healthier and it will keep you practicing for longer. You will not have to deal with chronic pain.
That's wonderful. Thank you so much, Dr. Vinti, for this beautiful information. Now, here Dr. Pooja Jain has joined in. So I know Dr. Pooja Jain had one, like when she was working, right, Pooja? So she's an oral surgeon and she had a sudden back spasm while
Sure.
working.
Yes.
What do in that kind of situation?
Okay, so for a spasm, usually what happens is it's a protective mechanism, right, from your body. Maybe that muscle has got overstressed now to the extent where your body is just trying to protect that muscle. So it will go into spasm. For that, I would suggest just rest. Don't immediately try and stretch a spasmed muscle because it might actually get worse. Just give it a few hours of rest. And what you can try to do for that is ice it. Okay, once it's iced, once it has had some rest, then you can slowly try and stretch and increase the mobility around it. And what is more important or as important as stretching is we need to strengthen the muscle. So what we need to understand is a weak muscle is a muscle that will always get stiff, is a muscle that you are overtly then going on stretching it, so it becomes a cycle until the time you actually take the time to strengthen that muscle. When that muscle is strong, it has lesser chances of going into spasm or getting injured. And then when you do the stretching, it's more effective even for that muscle.
Absolutely right. You know, basically, at times what happens is your lower, like, I don't know about other people, but at least I kind of stand and work all the time.
Yes. Yes.
So, you know, and your assistants are usually shorter than you.
Exactly.
So you land up, and because you want your assistant to see what you're doing all the time, your chair is at a lower level than it is what it is supposed to be. At that time,
Absolutely.
you're bending up, like, you know, you're really bending a lot, and that
Exactly.
causes of pain in the cervical area, especially the pain here.
Yes, yes, absolutely. So, like I said, for that, the more upright you are, the better it is. The more you bend, the more there is forward inclination, the
Right.
more your posture starts to move towards the patient. That is when that stiffness starts to develop. So, we need to try and maintain, always remember to maintain more of an upright posture, and especially for the neck. Again, when you're standing and working also, ma'am, you must be, you know, in a slightly, like, say, shrug position, so you're constantly tensing up from your shoulders. So you want to try and keep that a little relaxed and then do the work.
Actually, you're doing upper right molar 1/6.
Yes.
And it has fractured over there. Then you don't remember how you're standing, what you are doing.
Exactly.
That
Then
I
you're just involved over there. There is absolutely no the care about the posture, which I completely understand. That is the reason why I said maybe when we are doing the procedure, we're so involved in it that we don't have the time to think. But the more you practice, like consciously correcting your posture, or at least after you're done with the patient, just relaxing your muscles, even that is going to be very beneficial.
Because I've realized that many a times. Hi Akshata, and hi everybody. Hi Rohita.
Hi. Hi, ma'am. How are you?
I'm good. Hi Manisha. Oh, yes. Okay. So Rohita, what question do you have? Dr. Rohita,
Well,
God.
so basically, I deal with root canals. Of course, that I love doing it. But recently, I started, working on alcohol inks. It's like a kind of a medium we do paintings with. So what I regularly faced is like I have just recovered from frozen shoulder. Now, I'm sure most of us have been there, gone through that. So, I mean, since I work with the hair dryer, so my wrist, my shoulder is the parts which are, being worked upon a lot, and of course my neck, because we have to maintain a distance, we have to move it a certain way to get the required design. So how do we handle that? I mean, we love our work, but sometimes the pain takes over it.
Yes.
Absolutely.
Absolutely. So I think, what you can do is don't wait for it firstly to become chronic pain. Most of us, what we do is we keep waiting. We're like, okay, it's hurting. Maybe now the pain is somewhere, it's like a 4 out of 10. You probably wait till it becomes a 8 or a 9 out of 10 to actually do something
Yeah.
about it. So it's better that we actually start off when it, there's like the initial bit of pain. If you start that time, you're going to be able to take care of it in a much better manner. And for me, actually, so my mom is an artist. She's been an artist for the past 25 years. And she does canvas paintings as well, So even with her, I'm always correcting her posture while she's painting. So, if you see while painting, what happens is that you're constantly extending the arm. The arm is constantly under contraction. So what you can very simply just do is take breaks. Maybe you've painted for an hour, just take a break, right? Relax out those muscles, take a few seconds off. And the second thing also that we tend to overlook is, which is connected to this, is also hydration, right? If you are not hydrated enough during the day, you will definitely feel more cramps in your muscles. The more hydrated you are, it definitely helps your muscles even during this. And like I said, just practice correction of posture. I myself have dealt with it, and I have dealt with rounded shoulders and a lot of shoulder blade pain. And I think only once I actually started strengthening the muscles around my shoulder joint, and when I consciously started pushing my shoulders back and sitting upright, was when I saw a lot of difference, which applies to any muscle of the body, right? Even if you are an artist and that is maybe your forearm or it is your wrist, it's the same thing that you need to do even for those muscles. So our body works very well in those ways. It has these basic rules that you need to follow, and you will definitely see a big difference.
Yes.
So one question that I wanted to ask is there any particular exercise or something that we can do to, firstly, to prevent it? Secondly is, now once we have it, now what do we do? Because of course there are certain exercises. Some, like one school of philosophy says if your body is saying there is pain, you're not supposed to move it. One school of philosophy says if you move it, only if you move it, you're going to recover from it. Like these are like two schools of thought which were told by my orthopedician and my physiotherapist. I mean, I'm not saying they're wrong, but I have been through both and I don't know what to say to it.
Okay, so very simply put, something like say stretching or something like say cold relief or applying heat or taking analgesics, these are all going to be symptomatic forms of relief. They're going to give you relief, but if the same practice continues, you will have recurrent pain. It's the same thing. It becomes like a cycle till you do not take the time to strengthen. Obviously, if you had a major injury, then yes, rest is a must. Right? That is something that will better be decided by a practitioner, whether you should rest or not. But if it is just chronic pain and it's not like say a major injury, then you need to move. Okay, the more you do not move it, the more stiff it's going to get, the weaker it's going to get when you actually start moving it and you start strengthening. So I'm a huge advocate of using firstly strength and resistance training to build strength in that muscle. And once that muscle gets stronger, you can incorporate things like say yoga to just keep your body flexible, to keep your body moving, to keep the joints around it healthy. And thirdly, what you can just try and do is don't overdo anything. Right? You don't want to overtrain the muscle also. You want to maybe just do it twice to thrice a week, stick to that. And also just follow, if you are maybe talking to a healthcare practitioner about it, just follow also what they are saying. And then I think the most overlooked aspect is the nutrition bit also. Right? If your nutrition is not on point, again, it is something that's going to become a recurrent pain. So you need to take all of these into consideration and deal with that pain.
Thank you so much, Dr. Vinti, and thank you, Rohita, for coming on board. And because whatever question like other people can have, like whatever they are experiencing, they can have those kind of questions. Thank you, Dr. Rohita.
So
We are going
thank you
to
so much.
with Dr. Rohita as well, with her alcohol ink sometime soon. It's not.
Thank you so much. Thank you, Doctor.
Will see whether you're following your posture or not, Dr. Rohita.
Yes.
Yeah, I will. Okay, thank you so much.
Welcome, dear. Thank you so much for being with us. Very, very important. You're right. And on Vinti, like, like what thinking, okay, you think 1 hour a day and you are done 23 hours, you can do whatever you feel like doing.
Yes. So that is usually the approach that is done. I'm not going to particularly blame people for that, right? Because there are a lot of other responsibilities and priorities that you have in your day-to-day life. But yes, after, it's not that you finish your 1 hour of your workout and it ends over there. So that is actually what we also try to help with. We try to coach them in such a manner that we can try and also change their mindset a little. So it is also about eating better after you're done with working out, right? Which takes, obviously, it takes effort from your end to eat better. And also the sleep cycle. So sleep is super important, right? If you're going to sleep maybe just 5 to 6 hours a night, that's not going to be enough for you to recover, just even for your daily functions. So that is also something that you will see an improvement with. Once you start working out regularly, you see that your sleep cycle improves, and that is something that you can do to recover better. Maybe get in 7 to 8 hours of good sleep, undisturbed sleep. And also what I would suggest is maybe try and add 10 to 15 minutes of guided meditation, maybe just thrice a week. It just helps you to feel more centered. It's the time that you spend with
Yeah.
yourself and with your body. You can try and collect all your thoughts at that time, and you can just focus more better. You know what exactly has to be done, so use those remaining 23 hours of your day in such a way that it's going to be more productive towards your body and towards your health and wellness.
Right. Agreed. Now, tell me, what are the myths that you normally come across from, like, what they tell you, okay, if I do this kind of a workout, it is going to sprain my back a little more, or maybe workout is the only thing that is gonna help me reduce my weight, or the paunch, especially the paunch. I'm talking about
So
people postmenopausal, which is a
yes.
very big issue.
Yes. So I feel that because, like I said, with social media and with so much information being out there, it's very easy to get confused, right? So you need someone to guide you through the process. And it's very common. Like, I have people who come to me very often and say that, we love our body, but we just want to lose our arm fat. Or, we love how we look, or we just want to lose that little bit of fat that we have on our stomach. But what we need to understand is that our body doesn't function that way. So I can't say that I just want to lose weight here and choose that and just lose weight there. If I lose fat, I will probably lose it over my entire body. And obviously over there, genetics also plays a very important role, right? Maybe for some people, it's easier to lose weight on their arms, and they will probably lose their belly fat right in the end. Whereas it might be very different for someone else. So obviously, yes, spot reduction does not work. The only thing is you will lose, if you lose fat, you will lose fat over your entire body in no particular order, depending upon your body composition and genetics. So that is definitely one that we get a lot. And the second thing is also like just fad diets. People see maybe celebrities, or they see someone that they follow following a certain diet, and they also want to follow that, just thinking that it might work even for them. Very commonly, what people do is they just cut out a certain food group. So what very commonly you'll see is people just cutting out carbs and thinking that that will help them get results. But what you don't understand is that carbs are essential for your body. You need them. And honestly, I would say carbs are beautiful. Your body needs them. It fuels your body. And rather than just cutting out a full group of food, rather just cut down your portion sizes a little bit. Eat all the food that you're eating. Maybe just control the portions. Instead of eating a lot, just make that a little lesser, rather than cutting out quality ingredients of
And
food.
maybe
So
wells.
yes, absolutely. So even like when we say about like carbs, there are complex carbs, and then there are more refined carbs. Yes, refined carbs are not probably the healthiest thing for your body, but just complex carbs that you get from whole foods, what you get from your vegetables, what you get from your beans, now that is something that is essential. That is something that's going to really benefit your body. And that is something obviously that, yes, when people actually get guided through the process, they understand the why are they important for your body.
Yes. So when we talk about refined carbs, you mean the maida, basically.
Yes,
Which is
maida, any food that's undergone a lot of processing, right? That
refined.
can be anything. That can be something as simple as burgers, your pizzas, donuts, baked goods. These are very commonly, they are extremely refined to the point that their nutritional value becomes very less. There's very little that you're getting out of it nutritionally, but you're getting a lot of calories out of it. So
And
that is the reason.
to your soul when you have the donuts.
Yes.
But then not to the body. Well, what do you see? Many people just see maybe on Facebook or Instagram, as we discussed, and they start doing things on their own. So, what's the importance of a coach? Like, do you think a coach can really make a difference? Of so much information, there's already an information overload.
Exactly. So like I said, there's a lot of anything that you type into, even say Google or even into Instagram, you'll get so much of information over there, right? But what is going to be suitable for your body, depending on firstly your age, your gender, your body composition, right? What may have worked for you in the past or not. Google's not going to ask you for your previous history, right? So that is extremely important, and that's where a coach comes in, and they can guide you through the process, because also they have already trained so many athletes and so many clients, so they know what might work and what might not work for the body. So that is probably the reason I would really suggest that, if you feel like you're lost and you're overwhelmed by all the information over there, you should get someone who can guide you through the process. One, because it will also simplify the process for you, and you will not waste a lot of energy and time over especially over say like diets and fads that probably will not give you that result.
Right, right, right. Absolutely right. And what about like especially like when you become like older, like me, post
Yes.
50.
Yes.
So you get a lot of knee pain. So you were suggesting something like lunges and all. So lunges is something that becomes extremely difficult. So the
Yes.
modifications you have for those people who have knee pain.
So, like I said, even with say like something like squats and lunges, people feel that it's not safe for the knees, but it's actually quite the opposite. You just have to start out not doing a full lunge or a full squat. You have to start and scale that movement down. So we will start with a very easy version of a squat, where maybe I'll keep like a high table, and I would tell the athlete that I'm training just to squat till that table, right? You're not going all the way down, so the stress that's there on your knees is minimized. Now once they start to get used to that depth, once you develop strength at that depth, then we start adding a little bit of load to that kind of a squat. They maybe start using a small resistance band, then your body slowly starts to adapt to that, then you start to reduce the height to which you can squat. So it's not that the demands are going to differ from person to person. Everyone needs to squat, everyone needs to lunge. It's just the degree to which they squat or to which they lunge will differ based upon, yes, if it's an absolutely healthy individual, you should be able to squat completely, as compared to maybe someone say who has knee issues. We will work on strengthening around the knee joint, but you will still continue to squat, not to the full degree, but at least to some degree till your body can handle your full body weight.
Yeah, because that's something which I when I was actually doing, I used to have. I can see that you are hydrating your on and which is
Yes.
so that is one thing everybody has to remember is to drink water. I think one
Very
thing
important.
that people just forget. Just
Yes.
or maybe
Exactly.
are not if they want to, they are lazy about it at times.
Exactly. So that is also super, like we said, super important to stay hydrated, especially like say for us, like we are living in Bombay, and with the weather that we have over here, you know, you are all constantly getting dehydrated. So it's important that, you know, you keep sipping on a little bit of water every hour is important.
Right. What other important tips would you like to give our audience when you recover from a workout, like a post-workout recovery, basically? We can, like, probably that is one thing which makes people kind of little reluctant to start exercising because that first weekend extremely painful.
Absolutely. So, like you said, I completely agree with that. The first 2 weeks probably is like a shock for your body because you put so much stress on it by working out, right? So, what you can just, I would say, the best recovery tool is sleep, right? The more sound sleep you get, the better you will recover. So I would say aim for definitely 7 to 8 hours of sleep, and maybe just half an hour before you fall off to sleep, don't use any screens. So whether that's your laptop, whether that's your phone, you know, rather than going off to sleep watching something, maybe just take half an hour before you sleep to just shut all the screens off, and you will feel a big difference in the quality of sleep that you get. You might still be sleeping for 7 to 8 hours, but definitely the quality of your sleep will improve. So for recovery, definitely sleep is going to be super, super important. Like we already touched upon, nutrition, that is going to be the second thing that's important, right? The more say the more I wouldn't say like junk, but just like we said, like the more refined food you eat, the more dips you feel in your energy. You suddenly feel like my energy was here, and suddenly it just crashed. So it went from 100 to 0, which you will never feel if you're eating more of whole foods, more
Yeah.
vegetables, more fruits, more whole grains. You will never feel those energy crashes. And I think thirdly, the more you get into this routine of working out, your workout should actually make you feel energized. So after you work out, because of the endorphins, you should actually feel really good through the day. You shouldn't be feeling like tired. Yes, I understand in the first 2 weeks it's difficult, but as your body gets used to it, you should feel like there's like sustained energy through the day.
Okay, so we have one request. Just taking her in. Okay. Question. Yeah, yeah. Let's see. Uh, Vinti, actually, I'm really impressed that coming from a young generation of yours, you request everyone and I know demand rather that you should not have the screen time.
Yes.
One, say, an hour prior or something is really good because I guess nowadays, where do you get that?
Yes. You're constantly on one screen or the other. If not your phone, then
Yes.
maybe laptop. If not the laptop, then maybe you're playing something. So it's important to just have like those, you know, small pockets of time where you're just, even if you're by yourself or with your family or friends, when you're not consuming content and you're not on the screen, especially before sleeping.
Yeah, I guess Dr. Preeti having some issues joining in. Never the mind, she had asked that but you have already shown the stretching how to take care of your neck,
Yeah.
especially when you're doing. And nowadays, I guess many a times, like we do not have drivers. So many of us do not have drivers. Even driving causes a lot of your trapezius,
Yeah,
especially, and
absolutely.
back as well. So maybe you can do the same stretches even while you are driving. Or at the signals, maybe you can do the stretch.
With traffic, yes, absolutely. If you're stuck in traffic, always just at least you can just relax your neck muscles. You can move them. Even that, doing that simply also, it's like the muscles contracted while driving. If you just take those few seconds, it at least relaxes, and even that will give you a lot of relief.
Yes. Well, that was a very, very, very informative session, Vinti. Thank you so much. And if one wants to join you and your functional training program, how does one go about that?
So it's extremely easy. You can just get in contact with me. The fitness program that we run is called Third Eye Training. So we have our own page and we have our website as well. And all you have to do is just simply just give us a call or maybe send us a message, and we will get back to you and get started.
Good. You can expect that from me very soon. I'm really impressed with your knowledge and your workout as well, which I've seen on the Instagram handle. Thank
Thank
you
you
so
so
much for being with us, Vinti, today.
Thank you so
And
much, ma'am.
sure. And I would also like to tell everyone, our audience, that we are going to soon have an absolutely dhamakedar program, which is a musical program of all the words of dentistry. And the songs, we have so much of talent, so much of talent. And do not miss, every time it is not necessary to gain knowledge. Sometimes you have to just sit back and relax. So I'm sure the musical evening is going to do a big magic on you all. It's going to be a very mesmerizing evening. So and that I guess we're going to have it on Facebook. Okay. So see you all over there. Vinti, hope to see you there too. So after
Yes,
your workout, you can a bit with our musical evening.
yes, absolutely. Thank you so much for having me, ma'am. Thank you.
Yeah, thank you so much for being with us. Bye bye.
Bye.